you how to use diet and lifestyle to create a more healing environment for yourselves. And so I have to expressly disclaim any liability with respect to actions taken or not taken based on the information or other contents of these materials. This information doesn't create or is intended to replace the relationship with a qualified healthcare professional. What you need to do is to take all the concepts you're going to learn tonight and work with your primary care physician or specialist physician as you implement a more therapeutic diet and lifestyle to create a more healing environment for yourselves. And so, with that, let us begin. So in this webinar, I'm going to talk about some common health issues that are very common across primary care practices, across specialty practices. We'll talk about my personal story. We'll talk about functional medicine and how that is different from a conventional approach to multiple sclerosis and other chronic autoimmune conditions. And then, most importantly, I'm going to talk with you about how you can begin using a therapeutic diet and lifestyle to begin making changes to how your cells run the chemistry of life. And then we'll talk about how to find more support for you in this journey. Now, these are very common health concerns if you look at a primary care clinic, if you look at the epidemiology across westernized countries. Fatigue is the most common complaint. Brain fog and declining memory, also very, very common. Chronic pain, very, very common. And of course, more people have been sensitized to the issue of opioid dependence and are trying very hard not to be using so many narcotics. Many people have fatigue, pain, brain fog. They have autoantibodies, so they have symptoms, but don't have a specific diagnosis. And we have more and more people, both adults and children, that have brain and neurologic and psychiatric symptoms. In fact, 80% of Americans are now taking prescription medications, and the most common indications are pain, fatigue, and mood problems. Even more troubling, 25% of our children are on psychiatric medications for mood and behavior problems. And for children who've been born since 2000, 1 in 3 will become severely obese and diabetic. And of course, this is not sustainable for us as a country because of the huge economic implications. Children afflicted this way will have decreased worker productivity, totally independent of their healthcare needs. Let's think about Flint. Flint, as you may recall, had their water supply diverted and developed high lead levels in the water. The community parents recognized that the water smelled bad and that the children were having more behavioral problems, more rashes, more belly aches, and that the adults were having problems with headaches and pain. Now, the government officials said the water was fine. Fortunately, the community activists persevered, paid for outside lab testing that finally revealed the truth, that the water was very high in lead and that these children had very high lead levels. And so this community has an epidemic of lead poisoning affecting the children with neurobehavioral problems and future chronic health problems, and the adults that will have future chronic health problems. And the root cause of all this began with a change in the environment. So with that in mind, let me move on to my story. this became so deeply personal to me because of my own health journey. I was an athlete before entering medical school. I did taekwondo, I did marathons, I entered medical school, became less active, of course, did my residency, my medical practice, had a couple of kids. And then in 2000, I noticed I started having some stumbling and began to stumble a bit. I therefore saw my primary care physician. I ultimately ended up with a neurology visit. I had a big workup. I had MRIs of my brain and my spinal cord. I had a spinal tap. Then my neurologist went back, looked at my chart, saw that earlier I had been diagnosed with episodic facial pain that would later be called trigeminal neuralgia. And in '87, I'd had an episode of dim vision in my left eye. And so now, on the basis of lesions in my spinal cord, abnormal spinal fluid consistent with multiple sclerosis, and a history of prior neurologic events, the diagnosis of relapsing remitting multiple sclerosis was made. And I was advised to begin a disease-modifying drug. And being a conventional academic doc, I knew I should treat my disease aggressively. And so I did some searching to find who was the most skilled, doing the most clinical research in the Midwest, and that was the Cleveland Clinic. And so I went to the Cleveland Clinic, saw their best people, and they agreed I should take disease-modifying drugs. They recommended Copaxone, which I started. And over the next 3 years, I had one episode of weakness involving my right hand. So if I'd been in a drug trial, that would have been a huge success. But the problem was I needed a tilt recline wheelchair because I was getting slowly worse every year. And I then was advised to take mitoxantrone, which I did. I continued to decline. I was then advised to take Tysabri, which I did. I continued to decline. And then I was advised to take Cellcept, and I continued to decline. And for most people with relapsing remitting MS, within 10 years, they will likely convert to the progressive form of the illness, and they will experience progressive decline in mobility, worsening fatigue. In fact, 1/3 will need a cane, walker, or wheelchair, and 1/2 will be unable to work due to severe fatigue. Progressive, difficult to control pain may develop, and cognitive decline is increasingly apparent as a side effect of progressive MS. Now, if we look at autoimmunity in conventional medicine, we've gotten more sophisticated understanding of immune cell function. We keep getting smarter and smarter about the receptors and the cell types. And so we're able to design ever more specific drugs that are incredibly potent at turning off the immune pathways that are attacking self. And so these drugs are very potent. They're also quite expensive, $45,000 to $100,000 a year. But they can effectively turn off the acute inflammation. And that's an important goal because we're trying to stop the body from attacking itself. But because the immune cells are a potent part of our body, they're part of how we repair and maintain normal function. When you block the immune cell function, you will have important systemic side effects affecting your heart, affecting your mood. You may have skin problems. There's a higher rate of infection problems and cancers. And if you don't get to the root cause of why you developed the autoimmune problem, every 10 years you are likely to develop another significant autoimmune problem. On top of that, even though you can take a very potent drug to block immune function in rheumatoid arthritis, which is the autoimmune disease that has the longest history of being treated with these very potent biologic drugs. The research tells us that less than half will remain in remission for longer than 1 year. And remission greater than 2 years is rare. It occurs less than 14% of patients. So you have to keep changing drugs, adding new drugs, sometimes doubling up on the drugs, which means you increase the rate of serious side effects. What we really need to do is to get to the root cause of why people have the immune function going wrong. Why are the immune cells attacking normal, healthy tissue? Because what we want to do is normalize immune cell function, and we want to stabilize so our immune cells can repair and maintain our cells so we can regress disease activity and improve our health and vitality. Now, since I was first diagnosed, our understanding of the interconnections between what we eat and the environment, diet quality, exercise quality, sleep quality, social relationships, all those things interact with our genes, and that interacts with our immune cells. And the food we eat interacts with our microbiome, and the microbiome, that is the bacteria that live in our guts, interact with our immune cells. And it's the immune cell activity that then can turn on and make the severity of autoimmune symptoms worse or diminish them. And this is true whether you have multiple sclerosis, type 1 diabetes, inflammatory bowel disease, asthma, psoriasis, or other systemic autoimmune conditions. And this is another paper that looked at the dietary factors associated with autoimmunity. And no, coffee appears to be protective. Salt appears to worsen MS. Chocolate, some good news there, that appears to be protective. Resveratrol, deeply purple things are helpful. Omega-3 fatty acids, very helpful. Curcumin or turmeric, very helpful. Caspation, very helpful. You see, life is a continuum. When our cell chemistry and our hormonal balance is optimally tuned, we have great health. But if we begin to have our biochemistry functioning not optimally, if our hormonal balance begins to falter, we have less energy. We have declining mood. We begin to have more symptoms. We go see our physicians. We know we don't feel quite right. And they can't find anything yet. So that's sort of the pre-disease state. They send us back home. We continue to feel worse. And there's more damage, but the chemistry is still happening incorrectly. We go back to see our physician. There's finally enough damage that a specific diagnosis can be made. We're started on drugs. But we don't get to the root cause of why the chemistry was going wrong. And so symptoms will get worse. We'll need higher levels of prescriptions. We'll get multiple disease states. And then we'll get to function less and less well. And we'll begin to have disability. And then eventually we'll die as a complication of our disease states. This is the functional medicine tree. And so the top half of the tree, as a physician, I've been trained very well to make diagnoses based on your story, your physical exam, some lab testing. I treat you with drugs, and then when I can't manage your symptoms, I refer you to the specialist by organ system. So if you got a heart problem, I'll send you off to cardiology. If you got a brain problem, I'll send you to neurology. What the functional medicine folks have done so beautifully is we look at your family history, so that's sort of your genetics, and we look at these environmental factors: sleep, exercise, the quality of your diet, your stress practices, your relationships, your physical trauma, psychological trauma, the microbiome living on your skin, in your mouth, in your nose, in your gut, the pollutants, the chemicals you have stored in your fat, your spiritual beliefs, and your episodic triggers and events. And we see how all of those things can interact with your genes to shift how you run the chemistry of life. And that will lead to symptoms affecting your gut, affecting how your mitochondria manage energy, affecting how you transport through your heart, affecting your hormones, that is your communication, affecting your structure. And really, I think these are the most powerful: your sleep, your exercise, and your nutrition, particularly your nutrition. Now, I had, in 2001, my physicians had at the Cleveland Clinic told me about the paleo diet. After 20 years of being a vegetarian, I gave up grains, legumes, dairy, and started eating meat. It was a big deal. I continued to decline, but I stayed with that because at least I was doing something. I started reading the basic science. I started experimenting based on what I learned on supplements to help my mitochondria. I improved my energy. I diminished my fatigue, but I still was declining. In the summer of 2007, I could not sit up. I needed a zero gravity chair. I had difficult pain. I was beginning to have brain fog. I was exhausted by 10 in the morning. That year, I discovered functional medicine. I redesigned my diet in a very specific way, using what I had learned from functional medicine, what I was taking in supplement form. I put it in a very specific diet pattern. I went back to my daily meditation. I worked again with my physical therapist. And 1 year later, I'm walking without a cane. My pain is gone. My energy is good. My brain fog is gone. In fact, I'm able to do a 20-mile bike ride with my family. I have changed how I think about disease and health, and I've changed my clinical practice. So again, my timeline: my face pain began in 80. I had the dim vision in 87. In 2000, I'm diagnosed with MS. In 2002, I adopted the paleo diet after being vegetarian. In 2003, I need the wheelchair. I take Nalbantron. 2004, I take Tysabri. I add various vitamins. 2005, I take Cellcept. 2007, I'm working with my physical therapist, and I discover Institute for Functional Medicine. I have a few more supplements I've added. In 2008, I reorganized my food to the Wahls protocol. I'll tell you about that in a moment. And I've been on no disease-modifying drugs since 2008. Now, the food that you eat influences your human cells. It provides the building blocks to make the structures you need to exist. And it turns genes on and off. It can ramp up the inflammation or it can lower the inflammation. And the food you eat determines which microbes live in your gut. And will these microbes promote inflammation or decrease inflammation? This food has been designed to drive us to overconsume the food. It's very yummy, it's delicious, we love it, it's cheap, it's available, it tastes incredibly good, but of course it's terrible for us. And we're addicted to it. These are scans of our brain eating that sugar, that processed food, or eating cocaine. The food's been designed to make us addicted. We should be eating these radical things known as vegetables. Our grandmothers were right. We needed vegetables, a lot of them. We should have 3 cups of leafy green vegetables. They're full of vitamin K, which is great for repairing your myelin, and full of carotenoids. We should have deeply pigmented beets, carrots, peppers, berries. Color's been associated with lower rates of obesity, cancer, mental health problems. And we should have sulfur-rich vegetables in the cabbage, onion, mushroom family. These are phenomenally good for us as well. These will boost your ability to process and eliminate toxins, and boost your ability to make gamma aminobutyric acid, which is an important neurotransmitter that helps protect you against neurodegeneration. In multiple studies, having more color, particularly purple, blue, black, has been associated with improvements in people who have early cognitive decline. So my recommendation is 9 cups of vegetables, measured raw, 3 cups of greens, 3 cups of deeply colored, 3 cups of sulfur in the cabbage, onion, mushroom family. Now this is according to your size. I'm a tall lady. I'm 6 foot tall. If you're a man, you should be able to do 9 cups. If you're a tall lady, you should be able to do 9 cups. If you're very petite, it's going to be less. But you should do it proportionately between the greens, color, and sulfur. I want you to have a complete protein. If you're a meat eater, that would be meat. If you can afford it, grass-fed meat, wild fish. If you can't afford that, just do the best you can given your financial constraints. There's a lot of nutrition in organ meats. Liver is a superfood, so I actually do recommend liver once or twice a week. Now, my chief of staff and the chief of medicine was so impressed with my recovery. He gave me the job of getting a case report written up when he saw my remarkable recovery in 2008, which we did here. So this is my treating physical therapist, treating neurologist, myself, and some research scientists here at the University of Iowa. Then we wrote a case series of, again, with my physical therapist, how we used exercise and e-stim with progressive MS, and were able to improve function. And then my chief of medicine called me in and gave me the job of doing a safety report, a safety and feasibility study. And this is sort of a big deal. He thought this was so important that we should write out the protocol that I use for my recovery in a very precise way, and then go out, write some grants, get funding, so we could see if other people with progressive multiple sclerosis, could they implement this complicated regimen that I was using? And if they did, what happened? So it's called a safety study because I had to make sure we weren't harming anyone, and just wanted to show that the trend was in the right direction. Because when it's a small safety study, you don't expect to see a statistically significant difference when you're talking only 10 to 20 subjects. And our biggest side effect was that if you're overweight, you lost weight without being hungry. No one who was overweight lost weight and became underweight. In this graph here, the top 2 lines are quality of life measures. The green line is improvements in general health. The blue line is improvements in energy. If you can get a 5-point improvement, that's clinically very meaningful. And with progressive MS, you anticipate a 10 to 15% worsening every year. So even if all we had done was to hold people steady, that would have been huge. But we had clinically remarkable levels of improvement. The bottom line is the reduction in fatigue severity over time. And this is the fatigue severity score. This is a scale. People answer questions, 9 questions answering how fatigue impacts various aspects of their life. With 7 equal to total fatigue in every aspect of their life, and 1, no fatigue in any aspect of their life. So at baseline, they were quite fatigued. It's a score of about 5.8, and it comes down to about 3.3 at the end of 12 months. This is the largest reduction in fatigue that's been reported to date in the most disabled group of patients reported to date. And the p-value there is less than 0.0005. So that's really quite remarkable. The next thing we did was a randomized control evaluation. Again, a small pilot study. And in this study, this is a shorter study. We do just diet alone, and it's a modified paleo diet. People come in, they get their baseline assessment, and they're randomized. Half the folks got the diet assessment, half had to wait for 12 weeks, and then they'd get the diet assessment. And we trained them on the diet. We assessed quality of life. We assessed fatigue scores. We assessed walking, and we assessed hand function. And what we're able to show is that fatigue went down, quality of life improved, walking improved, and hand function improved compared to the control group. Then we went back from my original study, again, of the 20 patients with progressive MS, because we'd collected data on anxiety and depression, and we'd collected data on their thinking ability, and we're able to show that these are anxiety scores, so lower scores are better, so anxiety goes down, and depression scores go down very nicely. And what I'm showing you here is that verbal and nonverbal thinking scores improve. So they have improved thinking function. So we're very excited about that. You know, in issues, so at the same time, I've changed how I am treating patients in my primary care clinics at the VA, and I changed how I was treating patients in a traumatic brain injury clinic. And I was focusing more and more on teaching people how to use diet, stress reduction, and we'd just have them get a pedometer and begin walking. And what I saw time and time again, in all of our clinical trials and in my clinics with a wide variety of disease states, fatigue, people would come in within 1 to 3 months, depending on how soon they were coming back. They would consistently tell me that their energy was improved, they had less fatigue, that their mood was improved, they had more joy, that they were less irritable, that their memory was better, their sense of brain fog was diminished. The ladies would come in very pleased that they were losing weight without being hungry. The gentlemen would come in often very pleased that they were having erections again and that their love life was better. And then they would incidentally say, oh yeah, and I have lost some weight. And then the woman would say, oh yeah, and actually my periods are less painful. My hot flashes are less of a problem. And that they were more interested in sex again. So, and everyone very consistently was having less pain. And that was whether it was pain from a war injury, a neuropathy pain, a MS pain, a pain from rheumatoid arthritis, pain from fibromyalgia. Pain reduction was very, very consistent. Social support matters a great deal. We found that to be extremely helpful for folks, that who you have in your family, in your extended family support network makes all the difference in being able to implement diet and lifestyle changes. And, how do you find someone who can help you think this way? How it can help you think about your health problems through a functional medicine or integrative medicine lens, who can help you think about this through the lens of diet, lifestyle, sleep, exercise. How do you shift from just being focused on disease to being focused on how do I create a more healing environment for my cells? How can I create an opportunity so my cells can run the chemistry of life more and more correctly? So what I'm going to have you do is think about some easy, actionable things that you can start with, because I want you to have some early success. This is, in my experience, the most profound step that I've seen my patients take, both in clinic and in my clinical trials. And that is to think deeply about what you will do with better health. What do you want your health for? What do you want your health for? Now, in my case, when I was diagnosed, Zach was 9, Zeb was 6. They were really very young, and it was very rapid that my life changed, that I knew things were not going well. And so I was having to reimagine my life as I was getting more and more disabled. And so I'm thinking, what do I want my health for? What's most important to me? And what was most important to me was that my son and my daughter learned to become successful adults, financially successful, and emotionally successful. So I wanted to remodel resilience for them. And that meant I was going to go to work no matter what, and I was not going to give in. That I had to keep doing everything that I could because I needed to model resilience for those 2 kids. What do you want? What do you want for your health? And then I would urge you to remove an inflammatory food group. We know that for those of us who have an autoimmune problems, we're having our immune cells react overly aggressively. And for many of us, sugar, gluten, and dairy are part of the problem. So I would urge you, ideally, to take out sugar, gluten, and dairy. Do all of that. But if you can't do all 3, pick one and start there. You can take out sugar and replace it. If you need something, a treat, just have some berries. If you can remove gluten and dairy, do that. But whatever you remove it 100%. If you continue to have the gluten and dairy, your immune cells will continue to be overactive and may continue to be attacking your other tissues, leading to the inappropriate inflammation. And add more vegetables. We have so many studies showing the benefits of eating more vegetables. So get more greens, get more color, get more cabbage, onion, mushroom family vegetables in. And then you want to keep learning so that you can continue to grow and add to your skills as you move in your health journey. I've been slowly tinkering on my health journey, and I encourage you to do all of that as well. So follow me on Facebook, and that's at Terry Wahls. Follow me on Instagram at Dr. Terry Wahls, on Twitter at Terry Wahls, and on YouTube, Food as Medicine. And, for some people, this webinar will be enough. You'll be inspired and you'll be well on your way. But others need more information, more support. I've got some great resources. My original book, The Wahls Protocol, and the companion cookbook. You can pick up the book on my website. You can go to your library and check it out. There's way more information in both those books than, of course, I'm able to cover in this webinar. If you want even more information, we have a membership site where we have video lectures, audio lectures. You can hear what I am lecturing around the country, around the world, in terms of functional medicine, integrative medicine concepts, what I'm teaching other public and other physicians as well. And I also do a question and answer session for all the members, answering their questions and discussing topics that matter to them. We have a little e-course that's a number of video modules and some PDF resources that are very helpful for learning more about using the protocol. And for people who want to have menus and shopping lists, we have menus. And we have sort of the introductory diet, the level 1 diet, the little more comprehensive program, the level 2. And for those who want a ketogenic diet, we have that as well. And so this is a terrific resource. And if you want to have a comprehensive functional medicine understanding, if you see an integrative functional medicine doc, they typically will do a history and talk with you, understand all of your health events from before you were born, when you're in your mom's tummy, from birth to your present moment, in your various environmental exposures. We understand your modifiable lifestyle factors, how all these things contribute to your current functioning in your gut, your immune cells, your mitochondria, your detoxification pathways, your hormone balance, your structural integrity. And we put together a plan for how you can begin addressing your health challenges and what we think your most impactful interventions would be. Now, I have a 3-day live event that I've been having for 5 years, where I teach the lay public and I teach physicians and other health professionals how to use these kinds of concepts to evaluate people. We do a group of functional medicine consult together as a group. I walk people through their timeline. I walk them through how their symptoms map to their organ symptoms. I help them evaluate their lifestyle factors. And I help them discern which interventions will be the most useful to them. We have a beginners and advanced track. As I said, we do a functional medicine group self-evaluation. People find this incredibly useful. And we list the topics and schedule on the website. We create a community. And we develop and practice the skills needed to adopt and sustain the Wahls protocol. And we work on these resilience factors. We spend a lot of time talking about what you want your health for. And we go through many exercises to help you grow your internal motivation to do the work of changing your diet and adopting these new health behaviors. And I go through some of the latest research on MS. I talk about what's going on in my research lab. I have some of my research colleagues talk about what they're doing. We talk about chronic disease. We talk about mental health. We'll be talking a lot about physical activity and movement. We talk about stress reduction. And of course, we do a lot on diet issues. And then I have a small private practice where people who are wanting to be seen, and I will see them and do the evaluation and make recommendations for them. And we have a growing directory of other health professionals, nutrition professionals, physicians, health coaches, movement professionals who use the Wahls protocol concepts as they evaluate and take care of patients. Again, this is the most powerful thing that my patients do. And this is the most powerful step that you can do. Begin to do some free writing, do some journaling. Think about what you want your health for. When I look back on my life, when I was diagnosed with MS and when I was getting more and more disabled, it was so powerful that I had the insight to realize that what mattered most to me was for my son and my daughter was I wanted them to be successful adults. And even though I was becoming more disabled, I could model resilience for them, and that we could continue forward, or I could give up. And I chose to model resilience. I chose to keep going to work. I chose to keep reading and doing everything that I could and learning all that I could so I could create a more healing environment. So I want you to write out your answer. What will you do with better health? What is your mission in life? Remove an inflammatory food group. Remove sugar. Replace it with fruit. Remove gluten, dairy, or both. Add more vegetables. And now we're going to call on my good friend Annette, who is a Wahls warrior, and she has a great story. Annette, are you on the line with us? Annette, we're not hearing you.
Okay, can you hear me now?
We can hear you now. So, Annette, can you tell us a little bit about yourself?
Absolutely. First of all, thank you for having me this evening. It's quite an honor to be a part of your webinar tonight, and I want to thank you for all of this, for what you've done for us. I really started when I was in my late 20s. I had a lot of stressful events in my life, and so I think I had kind of a classic start that a lot of people will understand, starting out with optic neuritis in one eye, and then a few years later in the other eye. And just like everybody, it was probably in the early 90s. And so really, medical professionals really didn't know anything other than disease-modifying drugs. So I really didn't have a lot of options out there until I met you.
And what was your function like when we met, Annette?
Well, I'd gone back and forth. It was a slow progression. So I had the optic neuritis, and then I just, through the years, just kept slowing down. And by the time I learned about the protocol, I was struggling with my left side, a lot of foot drops on my left side, and then I lost a lot of use of my left arm and left hand. So it was a little bit tough. I really was struggling just to get through the days and just to be able to work and just to get around. It was an absolute struggle.
And what happened? So you met me. We got you on a diet and lifestyle program.
Yes. So it was absolutely life transforming. Within a few weeks, I started to have noticeably more energy. My stamina greatly improved. It used to be that if I wanted to go out with my husband, I always had to be with somebody. If I wanted to try and walk through the grocery store, I was absolutely exhausted by the time I actually made it out of the store, of course, leaning on the cart the whole time. And so that changed very quickly. Within an amazingly short amount of time, I suddenly, you don't even realize it's happening. And we go out again. Oh my gosh, I had been to 3 different stops, walked just fine, and it was remarkable. Just made a huge difference. And I feel like I had an increase in positive mental attitude. Before I learned about you and the protocol, I really was just frightened about everything. It was scary.
Okay, and in your family, do just you follow the protocol, or does the rest of your family? Could you comment on that?
I will. My husband has been a real trooper, and he does the protocol right with me. So we cleaned out the house. We don't have any flour, any sugar, anything that's tempting, because if it's in your house, I'm sorry, you're just going to be tempted. You can't say no. So we cleaned out all that stuff, and went out and started buying vegetables, and again, when we could afford it, we bought the grass-fed and the wild caught fish. Sometimes we can't afford it, so we don't always buy it. But the bottom line is, it was still better to eat salmon as opposed to a Snicker bar. So we learned a lot, and it helped both of us. We both lost a lot of weight. We both feel remarkably better and have so much more energy and such a better outlook on life. It made a huge, huge difference.
And did it have any health impacts on your husband?
Yeah, he lost a lot of weight. He was struggling with prediabetes, and that all went away. So he really had quite a turnaround, and he's very pleased with it because it increased his energy, increased just his outlook too. I mean, when your body feels better, everything is more joyful. I mean, in your relationship, in your work, like, everything is better. It makes a remarkable difference, and I think people don't understand until they actually do what you say and give it 100% and actually give it a chance to work.
Yeah, and so would you say you saved any money from your prescription meds?
Oh, yeah.
Can you comment on that?
It is shocking. I did for several years, was on Rebif, never really had any positive outcome from that. And really, at one point early on, we were spending a little over $10,000 or $12,000 was our cut of the drugs. So it was a huge amount of money. So when you say it that way and you say it out loud, so really think of how far that's going to go in your budget at the grocery store. I mean, it was huge.
Mm-hmm.
Insurance
Mm-hmm.
just wouldn't pay those crazy expenses that we had.
Sure. And Annette, if you hadn't discovered us, what function do you think you'd have right now?
I think I probably would be in a wheelchair by now, and I wouldn't be working. I still work full time, and
mm-hmm.
I'm moving, and I'm doing things, and I'm living my life, and enjoying it, having a great time. So it was life transforming, Dr. Wahls. Everything that they said would never happen, they were wrong. It does get better. You can do it through the diet, the exercise, and the stress reduction. It makes all the difference in the world. So I hope people will really, really reach out and start looking at the protocol. It makes a tremendous difference.
And you've been to the seminar?
Yes, I absolutely love the seminar. The seminar is a family that we get to spend several days with, and you're next to people who live what you live, so they really get what you're dealing with. And it's comforting, encouraging, and it's absolutely transforming. I always look forward to going back every year. You meet new people, get together with your friends that you've met over the years. I can't explain enough how wonderful it is. It just, for the first time, you're actually around people that they get you. They get what you're living.
And so have you gone year after year, Annette?
I have. I've been very fortunate to be able to go each year, and you learn something new every year. It's always so good. You'll hear something again, or you'll tell us about something, and you go, oh my gosh, I know I heard that. We get new stuff every year, but we also get to repeat some of the things. But it's so interesting how you go, oh, I knew that, but I forgot about it. Or I really need to add that to what I'm doing, because that maybe is another thing that I can try to get even better than I am right now.
Yes. Well,
Annette,
this is good. I'm so glad that you've had your such success. And again, truly, everyone, Annette's done very well. Her husband has done very well. I think it's been a joy. We get immense joy watching those kind of successes.
Well, we thank you so very much. It's because of you.
Oh, thank you, Annette. We're going to go on to a little younger person, and this is Wahls warrior Kirsten. And I know a lot of people are thinking, like, if I do this, my kids won't do it. Am I going to be hurting my kids, making them eat all these vegetables? And so we're going to hear from a young person whose life has been transformed with the Wahls protocol. Kirsten, are you on?
Yes, hi.
Hey, Kirsten. Thank you so much for coming on board. Why don't you tell everyone a little bit about you?
Okay, well, my name is Kirsten. I'm 15, and I'm a sophomore in high school. And I just wanted to say I'm really looking forward to talking at the Wahls conference in July. And I have been on a gluten and dairy-free diet since the age of 2, and I'm now on a Wahls paleo diet. And over my life, I have had a lot of ups and downs over the years, but I hope to help everyone here think differently about diet so you can, stick to it and maintain it.
So why are we on a gluten-free diet? And why did you change from gluten-free to Wahls paleo?
Well, I was really sick as a baby, and I started to have horrible autoimmune disease and horrible GI issues. And then they finally figured out that all of these autoimmune diseases were because of my gut issues. And so the start of my recovery started with a gluten and dairy-free diet when I was between the ages of 3 and 5. And the gluten and dairy-free diet resolved most of my symptoms, and my development and all of that was back on track. And I just was growing up and going through the kid years and just experiencing being on this like weird diet. But then as I became a teenager, I began to cheat on my gluten and dairy-free diet a lot. And over time, I started developing new symptoms like stomach aches and headaches and like brain fog, which is what you were talking about earlier.
Yeah.
And that's when my mom decided to put me on a strict Wahls paleo diet. And that's what I'm still on today.
Was that transition hard, going gluten-free to Wahls paleo? Was that a little difficult at first?
Oh, yeah, because it was very strict. And when I first went on it, I was not happy about it because, like, I couldn't have any grain or carbs. But then over time, I just kind of got used to it, and it's kind of my normal, and I barely thought about it anymore once I put things in perspective.
Well, once you began to feel well and your brain woke up, did you see any changes with your skin, Kirsten?
Oh, yeah. During the time when I was, like, cheating a lot in my diet as I was getting into high school, I started to get a lot of acne on my face, and we could not figure out why I was getting all of this acne. Like, I tried all these skin routines and things like that, but then we started to figure out it was something more internal, and it was inflammation, and that's what was causing all the acne on my face. And so once I was on the strict paleo diet, I couldn't cheat at all. My face really started to clear up. And it's still, like, clear now, and that's how I know that I can't cheat or anything like that.
So, Kirsten, you and I are going to have do a presentation at the seminar. Why don't you tell everyone what that's going to be like? Because I think it'll be good for people to hear.
Yeah, well, basically, in my talk, I'm just going to talk about my life growing up as being sick, really sick in the beginning, and how diet has changed my life getting older, and then specifically talking about when I started cheating and me thinking that I kind of just grew out of the gluten and dairy-free diet, but then realizing that it was really hurting my body, and then I had to switch to paleo. And I kind of just talk about, like, different stories and then tips and tricks, I guess, and, like, advice for other people, because over the years I've had to learn, like, how to deal with certain things or different little, like, tips to, like, help me stay, like, maintain my diet and things like that.
Yeah, for everyone who's listening, this was a hugely, very, very popular talk to hear from a young person, their perspective on what it's like to go through this diet transformation and how Kirsten manages at school and socially. So Kirsten and I have lots of fun, and we humiliate her mother just a little bit. So
oh my gosh, yeah.
So I just want to thank you so much, Kirsten, for chatting tonight, and for graciously agreeing to come talk at the seminar again. Because I think this is a very important message for families to get. So thank you, Kirsten.
Thank you.
Okay, now I just want to touch base that many people with MS and with a systemic autoimmune issue, the disease will progress over time. And we don't know why, but it appears that the altered physiology often leads to pain that's difficult to control, worsening pain, more problems with depression, anxiety, cognitive decline, excessive weight. And so using diet and lifestyle to create a more healing environment often is associated with improved function and fewer symptoms. So we do have some bonuses for all of you for graciously listening to the webinar. We have some free recipes. We have, in the seminar, if you choose to do that, you'll get a month free in the new Wahls Protocol membership area. We've got the link for you where you can reserve your spot. I think Callie's on. We have a few minutes for a few questions. Callie, are you on?
Hi, I am on.
Okay.
All right, so we had lots of questions come in. So most of these I'm just going to, I've had to pick out the most generalized ones since you can't really give, specific medical advice. And I've tried to gather most of the more popular ones just to cover the more questions at that point. So I'll start with my 13-year-old is suspected to have MS. We are a vegetarian family. How do I apply this protocol under these circumstances?
Oh, absolutely. So the vegetarians can certainly still do the Wahls protocol. My book, the Level 1 diet, you use gluten-free grains and legumes. So you could have black rice and black-eyed peas, for example, for your complete protein. You still eat the more vegetables, and there's some supplements that I'm going to recommend. But I'd urge them to pick up the Wahls protocol, and I give much more specific guidance for the vegetarians. You absolutely can do this as a vegetarian or a vegan.
I have had a number of questions about the protocol's effectiveness with Parkinson's. Can you comment on that?
Oh, sure. So we do have quite a number of people with Parkinson's who have adopted the protocol, and that reduces the inflammation. It slows down the neurodegeneration. I've had the Parkinson's folks tell me that they're less stiff, they have less tremors, there's more mental clarity. And so this has been very helpful. We've had some folks post their photos up of their before and after. There's one lady who had so much tremoring and was so stiff she couldn't really feed herself. And after implementing the protocol, she was pleased to say she's now out taking her dog for hikes. So we've had some very remarkable transformations.
Can you comment on making when dietary changes aren't sufficient enough? What role does supplementation have, and how can people, how should they go about supplementing?
Sure. So in my book, one of the chapters I have talks about supplements, and so I review my thinking about supplements and how to evaluate which supplement may be the most useful. For starters, I do recommend everyone get a vitamin D level, and then to begin taking supplemental vitamin D, monitoring your level and getting your level to the top half of the reference range. I also talk about many people benefit from some omega-3 fatty acids in addition. On top of that, depending on your family history and your symptoms, there may be other supplements that we'd recommend. But that's a more nuanced conversation and I provide that guidance in my book in the supplement chapter.
Great, thank you. You mentioned about the diet working with RA. Does it help with like Hashimoto's, fibromyalgia, other autoimmune diseases?
Sure. So when I look back at, again, my own clinical experience, fibromyalgia is a very, very common reason that people were referred to us. So we had many folks come up with fibromyalgia who had a lot of pain and were actually often on disability because of pain. We got them on the program. Their pain remarkably reduced. They lost weight. Their activity level improved. So very helpful for fibro. Hashimoto's, again, you may still need to have thyroid medication, but people often find their weight improves, their energy improves, and their mood improves, and the dose of thyroid medication diminishes. Rheumatoid arthritis, lupus, psoriasis, inflammatory bowel disease, psoriatic arthritis, Behçet's, myasthenia gravis. These are systemic autoimmune conditions that we've seen remarkable clinical improvements as people have implemented the protocol.
Great, thank you. Is there a natural way to cure bipolar?
You know, so we had people referred to my therapeutic lifestyle clinic with mental health issues. And so that would be anxiety, depression, PTSD, post-concussive syndrome, bipolar. And we would use diet and lifestyle to optimize their cellular function again. And we often had remarkable improvements in mood. People, including people with bipolar. So certainly we have observed that.
Great. This is a common one. Do you feel that the body can still heal itself even if somebody's been diagnosed 10 years before starting the protocol? I think that a lot of people have had a long duration of disease and are
Sure.
maybe hesitant about starting this, thinking that they may or may not be healed.
Keep in mind that the altered chemistry of our before the disease is diagnosed is often present for 10 years. Then you get your disease diagnosed. And certainly it's easier the earlier in the disease process that you start these changes. But whenever you start them, you can improve how your cells run the chemistry of life. Symptoms that we see improve quickly are pain, fatigue, and mood. Motor changes in terms of strength may take longer. It's usually going to require some physical therapy in addition. So if someone is wheelchair bound, but they have a lot of pain and fatigue, it's certainly worth trying. The pain and fatigue, I anticipate, will respond quickly. Their motor strength, if they work with a physical therapist, they may see some benefit. But you'll have to work closely with a physical therapist.
Great, thank you. Yeah, that's something that was a common question too, just about movement and exercise. And I think that's important too, is that that needs to be a personalized.
It's personalized, and we will. We're going to have a bunch of movement experts at the seminar talking about that very issue as well, because we have a lot of people asking about eSTEM. We'll be talking about that at the seminar, and we'll be talking about various ways to approach movement.
Great. I'll do one more since we're at the top of the hour.
Yes.
I think we've had a number of people asking about the updates on the studies that you're carrying out, and one specifically about what your thoughts are on the SWANK diet.
Oh, sure. So the SWANK diet, brilliant work by Roy Swank, who observed that a low saturated fat diet, if started early, seemed to decrease the risk of disease progression. Started late, it did not make any difference. He also gave people cod liver oil and B vitamins, which was very, very helpful. And he since died. The Swank Foundation has modified their recommendations to make it actually much more like my diet, and so they spend a lot more time talking about vegetables now. That he doesn't have any randomized controlled trials. He just has a cohort of patients that he's followed. And so there's a lot of concern that this may have been a selection bias. So we don't know. But he has 144 patients that he's followed over a 50-year period. So that was very helpful. The McDougall diet, which was showed a trend towards reduced fatigue, but no change in disability status or MRI structure over time. We have small pilot studies which are remarkably positive, and we are presently doing a much larger randomized controlled trials funded by the National MS Society. And what I would tell everyone who's listening is that the MS Society is not going to give $1 million to a researcher that they don't think they don't have a high confidence is going to conduct a sound study that will yield positive results, because they have to be, responsible about how they spend their money. So they're only going to give their money, particularly an award of that size, to a study that's been well designed, has passed peer review, and has a high probability of success. And we're one of the largest awards they've ever made. So it's a very big deal that the MS Society awarded the money, believed in our protocol, and I passed peer review. And we'll be recruiting through 2019, analyzing our data in 2020, and hopefully getting publications out in 2021. And I know that sounds like a terribly long way off, and it is, but that's the nature of science. It's sort of a slow, methodical process, and we just have to be in it for the long term, which is why at the same time that I do the research, I'm trying to teach the public what I'm doing, why I'm doing it, so the public at the same time can decide if you want to wait for the research, that's a great decision, or you could begin trying these dietary principles yourself now if you decide that vegetables are pretty safe, that meditation is pretty safe, that exercise is pretty safe, and you want to begin creating the most healing environment possible. That's why I'm putting that information out there. And why we have so many ways that you can get more support. The books, the membership site, the course, a menu plan if you want that, the seminar if you want that, or a few people can come see me, but we don't have room for that many, so only a handful get to do that. And that we're training a cadre of health professionals around the globe that can help people use these concepts in their wellness program. So with that, I think we've shot over our time.
We did.
I thank all of you for staying with us to the end, and we'll be looking forward to helping you on your healing journey.